You're very welcome back to Ireland AM. Derek and Shiva have left us for greener pastures this morning, by which we mean they've hopped on a bus down the road to Clonmahon.
Okay, how are you two getting on now?
Hey guys, thanks Martin and Elaine. We're here this morning at Veterinary Specialist Ireland, and for our first bit of vet training this morning we'll be having a bit of a heart-to-heart with Dante the cat.
Oh, he's gorgeous, isn't he? Oh, absolutely. Anyway, we're all animal lovers here, but without a doubt we all do worry about our pets, and especially when it comes to the topic of heart conditions. We're joined now by specialist Dr. Jenny McInerney. Dr. Jenny, good morning to you. Let's get straight into Dante. What are we doing here this morning?
So, we are doing a heart scan on Dante. It is called an echocardiogram, and it's essentially the most sensitive method that we have for looking at their heart. So if you can see here, with Dante, he's got 4 chambers in his heart: the left ventricle and atrium, and then the right ventricle up here, and the right atrium. Now, we know he does not have heart disease, and this is a good thing, obviously, but Maine Coon cats like Dante, they are predisposed to certain heart disease.
What age is Dante, by the way?
He is 3 years old.
He's only a young fella, really.
Exactly.
The size of him.
I know, for a 3-year-old.
I know he's an 8-kilo cat, so he's more like a small dog, really. But his, so his breed, along with other breeds like domestic shorthairs and Sphinx cats, they can get a thickening of the heart muscle. Now, so when we look at his heart, so the left ventricle is important to check out. If that wall becomes too thick, over time it can cause pressure increases within the heart, and then, worst case scenario, it can result in congestive heart failure. So we really need to be checking these patients when we're suspicious of heart disease.
Okay. Yeah. And Olivia Flanagan, you are head nurse here, and you're a bit of a cat whisperer. What's the best thing to do to relax a cat when it comes to these procedures?
It's all about the handling, really. It's just about gentle handling. Cats don't particularly like to be held really tightly. So Dante here, we have a good hold of him and we're set up, but it's about not holding on too tight either, that they have a little bit of control and a little bit of movement.
Sorry, we tempted fate there, did we?
And talking to them and keeping it very relaxed and calm. And other things that we'll do is we'll spray like synthetic pheromones and things like that for the cats.
And would that help calm him down?
It's a calming pheromone that will keep the cats. It sets the environment up for stress-free, basically.
Okay, God, yeah, you'd need that, wouldn't you?
Good boy.
Oh, he is just beautiful.
And happily, no heart disease.
No.
This is good.
Are echocardiograms painful for them at all?
No, they tend not to be. I think in people, at least, they comment that it can be a little bit uncomfortable if you're sitting on a rib or something, but generally speaking, they tolerate it really well. If we're having, if they really won't lie, we can use a very mild amount of sedation, but generally speaking, it's fine.
Like, not only is their physical health quite important, also their mental health, right?
I know, exactly. I mean, that's paramount. So we don't want them struggling throughout the exam. So if we're worried about them at all, we'll give them a little bit of sedation just to take the edge off.
I've got 2 little boys at home, Maddie and Thor. Good morning. They're about the size of this little fella as well. I mean, how often should you get them checked?
So a year, every time they're at their regular vet getting a health check, listening to the heart is so important. So if there's anything like a heart murmur or any rhythmia, or they have any abnormal heart sounds, that can be time to recommend an echo. But for sure, if they're at home and you're noticing any signs like decreased appetite, lethargy, or really importantly, if they're breathing too fast or anyway laboured, it's really important to check their heart.
And so when an owner hears from a vet that their pet needs an echocardiogram, should they be worried?
I know, not necessarily. Do you know what? In cats, they're actually a lot different to dogs. They can have benign heart murmurs. They can have a murmur and it be no cause of concern. Now, they obviously can get heart disease as well. So, no, I think, if they're really well in themselves, getting an echocardiogram shouldn't be a cause for concern.
Now, I know we're going to move Dante out here because we have a little doggy coming in, but you kicked off your career in Cabra, I believe.
I did, a long time ago. Now, yes, I did. I did some small animal practice in Cabra, and then moved actually to the UK for 10 years.
You were up to Glasgow, Scotland.
Yeah, and I did my certificate in cardio there. So that's where my love of hearts developed.
And from there, of course, you moved down to London.
I did.
You've been all over the place.
I know. And then 2 little boys along the way. I give a shout out.
And what brought you back here then?
If he can shout out his voice, you can shout out yours.
No, go on. What brought us back here?
Yes.
Family.
Okay,
Yeah, and I was so lucky to get a job here. It's just so great. Hello, darling. This is Faye.
This is Faye. What age is Faye?
Faye's only young. She's 2. Yeah.
Okay.
And Faye is hi, little one. She is so good. Hi, darling. I'm actually going to attach an ECG to Faye.
Okay.
Yeah.
And what's that for?
So this is basically, well, to look at her heart rhythm, but to be honest, when we're doing a heart scan, when I take images and I go back and look at them, it helps me know what time of the cycle, you know what I mean, that I can measure things at.
You actually
essentially.
connected to her pulse.
Yes, exactly.
Okay, wow.
Yeah,
That's
I
interesting,
know.
isn't it?
And then this, yeah.
How different is it treating a dog and a cat with
Yeah.
an echocardiogram?
You do them the same way, but what you find is completely different. So if you can see here, this is her little ECG. Yeah, so this is a very normal heart rhythm.
What is the normal heart rhythm of a dog?
So, well,
How many heartbeats a minute?
Oh, a sinus rhythm of roughly about, I guess, 120, 80 to 120, if they're stressed and they're in a situation like this. Actually, she's at 90, so that's totally fine.
So she's nice and relaxed.
Yeah, but they can actually go much higher, 160 or so.
Does it depend on the size of the dog?
No. A lot of people think that, but no.
Okay, good to know.
Aged puppies, they'll have a higher heart rate.
Right.
And stress, they're the biggest effectors.
Right, so you're going to let me have a go at this, are you,
Yeah,
Jenny?
you are, exactly. Let me
Living out
get
my
you-
childhood dream of becoming a vet.
This is AM Vet Live, right?
Okay, wait. I'm going to gel you.
Oh, she heard I was going to do it. She got a bit nervous. Sorry, Faye.
This is the transducer.
Okay, I'm gonna leave that
and
here.
You're basically going, I know, darling. So we're going to bring her back just a little bit. I know, Faye, well done, darling.
Well done.
And then we're going to come up here. I know, babe. So do you see that she has a little gap here where I've shaped?
Yes.
You're going to sit down.
Okay,
Hold on. You're
okay,
going to sit
okay,
down.
great.
I'm setting you up. And then basically I can help you, but this is her heart overall in a 4-chamber view, okay?
Great.
So you're gonna have a bash.
Okay, super. Oh my goodness.
Yeah.
Who said, look, I didn't even have to go to college for this, guys. It's great.
Loads
I
of
know.
gel. It's a bit
Okay,
messy, and I can hold your hand.
quiet, isn't she?
Yes.
Oh, she's so
well
good.
behaved.
She's so
No,
good.
have
So
I-
we want to go. Don't worry.
Yeah.
You want to go right under and a nice straight probe. That's good.
Okay.
Oh, there we go.
And then, okay, that's good. So actually, you've landed on her aorta. That's the
Okay.
biggest
You missed your
vessel.
calling.
There's time yet, you know?
Yeah, we can stick a bit of colour over that. Let me help you. Hold
Okay.
on. But essentially, when we're doing heart exams, we're looking at all of their vessels, all of their valves, and their chambers as well. And we're just
Great.
looking there. You can see
Well,
that
that
kind of
is
colour.
incredible to watch.
Gorgeous.
Dr. Jenny, thank you so much,
Thanks,
Olivia and all the
Jenny.
crew here.
Welcome.
Shiva, I think you found
Look.
yourself a new job.
I'm gonna go sign up here, but there's lots more still to come from us. Until then, though, let's get back to studio.
Wow, she's so good, isn't she?
Oh, how cute.
Very, very cute. Still to come this morning, we learn the lessons of love with dating expert Paul Brunson.
Plus, did you know that today marks World Almond Day?
Did you get a card? I didn't get a card yet.
I'll make you one later. Or do you know what else? Someone's
Well,
going to make
maybe a
Chrissy. Yes, we're using this ingredient in a cake a bit later. See you for that soon.